I think there was a lot of good things that came out of this legislative session. However, I do believe there were some missed opportunities. And one of those missed opportunities was the creation of the Louisiana Office on Women's Health. There were a couple of bills that would have done that. The main one that we were focusing on was HB, House Bill 193 by Denise Marcel. That bill was passed unanimously in the House through both committees, Health and Welfare, Appropriations, and then on the Senate floor, 98 of the representatives voted for that legislation unanimously. And so we believe that it came to the Senate, it was sent to the Senate with strong support from the legislature, and of course strong support from the advocates, the over 50 organizations that are part of this campaign that is behind this Office on Women's Health. All of those voters, all of those supporters in the legislature in the House sent this bill over to the Senate only to have it stalled in Senate Finance Committee. The bill did not get a hearing in the Senate Finance Committee, and we, the public, don't understand why it was not allowed to be heard in Senate Finance Committee. In essence, shutting it down, killing the bill. The remaining members of the Senate did not have the opportunity to vote for the bill. The 9 members of the Senate Health and Welfare who voted for a similar bill, the companion bill by Carter, Senate Bill 72, they voted also unanimously to create this office. It is very concerning that the bill was shut down literally because it could not get a hearing in the Senate Finance Committee. And as a member of the public, we deserve an answer as to why this bill, when it had such strong support from the public and strong support from the members of the legislature, why this legislation to establish the Louisiana Office on Women's Health was not allowed to be heard in the Senate Finance Committee.
Why is it important, in your opinion, that this office be created?
Louisiana is currently 50th as it relates to our overall health outcomes and 50th as it relates to the health outcomes for women. That is simply unacceptable. And we know that as a state we can do better. This is a public policy matter, and it is time for the policymakers to step up and to address this issue. Maternal mortality in this state is totally unacceptable. It is way outpacing our peers in other states. Too many of our women, our mothers and our babies are dying in childbirth, and that cannot be allowed to continue.
How could an Office of Women's Health address those issues?
An Office on Women's Health would provide dedicated resources, a mission that is purposed to address women's health issues and to coordinate the services for women, to make sure that programs are developed, evidence-based programs and services are provided. Consolidation is also an important issue. We know that there are a number of programs and services that are scattered about here and there that could be organized under one umbrella organization that has a focus and that is held accountable for improving these health outcomes.
How can people get more information?
People can get more information by contacting us. The best way is through the website. It is Women's Health, the number 4, Louisiana. Again, that's Women's Health, the numeral 4, Louisiana.com.